Many people think that FHIR is simply just something on a compliance checklist. But now we're starting to see the advances FHIR is making in areas hitherto people didn't think were possible. So, for example, work done with the CDC with regards to public health, or patient engagement, as Khan mentioned. So we had a lot of individuals from various U.S. hospitals in the Northeast, and they were speaking about how they're using Smart on FHIR to connect to their EHRs. And so patients have a choice with regards to the apps they can actually get their health data. So, for example, certain health conditions, you might need to take multiple blood tests, you might need to take multiple X-rays. So we have FHIR resources with regards to observation and diagnostic reports. So patients, as Khan mentioned before, we live in a world now where people expect choice and ease of access to use, and there's nothing really more pertinent than your health data. And I think it's something that touches a lot of people, because you're going to be a patient yourself, or you have a loved one or family member who is a patient themselves. So, for example, my son, he has a condition called benign neutropenia. And so effectively, long story short, he lacks a certain type of white blood cell. So he has to go get blood draws pretty regularly just to kind of monitor everything. And my local hospital, Sick Kids in Toronto, they have a patient portal where parents can log in and they can actually track the progress over time. But it's actually much more helpful than that, because when, God forbid, he goes on vacation, he, experiences symptoms, I can go to a local hospital and I can have it on my phone and say, hey, this is what the doctor has recommended, in an ER room that might not be equipped. And so you might get doctors who are not aware of his condition, but once they see the notes that his home doctor has actually put on his patient portal, they know exactly what the protocol would be.